In Ghana, an estimated 2,797 women are diagnosed of cervical cancer, where 1,699 die from this disease every year. Cervical cancer is ranked as the second most frequent cancer among women aged 15 to 44. This is according to ICO Information Center in 2003. This is the Lab Doctors channel. I will entreat you to subscribe to this channel, like, share, comment, and let's do this together. So, in West Africa, 4.3% of women are estimated to be harboring human papilloma virus type 16 and type 18 infection in a given time. 55.6% of invasive cervical cancer are attributed to human papilloma virus type 16 and type 18. Cervical cancer is developed in a woman's cervix. That is the entrance of the uterus of a woman from her vagina. Almost all cervical cancer cases, that is 99%, are linked to human papilloma virus, an extreme common virus transmitted through sexual contact. In a nutshell, human papilloma virus type 16 and 18 is the principal cause of cervical cancer in women. Let's take note that from the start of cervical cancer infection, there might not be signs and then symptoms. In most cases, noticeable signs and symptoms set in when the tumor has advanced or when there is a growth that has advanced. This is where you see signs. So let's take note as we take them one after the other. Our first point is vaginal bleeding. This bleeding sets in after sexual intercourse, between your period, and even during sex. These are abnormal bleedings that are not supposed to be seen either during sex, after your menses, and then within your periods. And so, if you notice this very sign, please kindly run to your doctor. Our next point is heavy menstrual bleeding. A heavy, watery, bloody vaginal discharge with a foul smell. Not the normal discharges we experience when we have yeast infection or when we have UTI infections. No, just as described, a heavy, watery, bloody vaginal discharge with a foul smell. That is a bad smell. Please kindly see your doctor for examination. Our last sign is pelvic pain. Now we are proceeding to how cervical cancer is diagnosed. Remember, early detection is the key to effective treatment. How then do we help ourselves so that in case we are infected, it does not advance to its late stage? Our first point is through cervical cancer screening. This is the only way to help you detect cervical cancer in its early stage. So we are entreated to undergo or undertake regular cervical cancer screening. Our next point is pap smear test. Our next way of diagnosing cervical cancer is through colposcopy. This is where a magnifying instrument is used to examine your vagina and cervix to detect for abnormal cells. So in this situation, if any abnormal cells is detected, then a confirmatory test is done and immediate treatment is given to help solve your infection. Our last point is biopsy. This is also another means where cells are picked from your place of infection and examination is done. If any abnormal cells is detected, immediate treatment is given to help save your life. So, what puts you at the risk of getting cervical cancer infection? Our first risk factor is sexual activity and sexual activeness. Engaging in early sex before 18 and then having multiple partners increase your risk of developing cervical cancer. Long-term usage of oral contraceptive may increase your susceptibility of having cervical cancer. Our next point is smoking. If you smoke a lot, you increase your risk of getting cervical cancer. Our next point is previous human papillomavirus infection. As earlier said, human papillomavirus is chiefly responsible for cervical cancer infection. And so, if you have ever been infected with HPV virus and you didn't get the appropriate and then correct treatment, there is a high possibility of you developing cervical cancer. Our next point is family history. If you have a family history where either your mother, your sister, your auntie, a sibling was or is infected or developed cervical cancer, then there is a high possibility of you developing cervical cancer. And so in this case, you are advised to go for regular cervical cancer screening. So, how then do we prevent cervical cancer? Our first point is regular cervical cancer screening. This is the most effective way to prevent cervical cancer infection. Walk to any health facility, talk to your nurse, and they will be glad to help you do this test. Remember, early detection results into effective management and successful treatment. Practice safe sex. Be faithful to your partner. Please, you are also advised to abstain from smoking. Take in diet that contains a lot of antioxidants. They are noted to help fight against infections and cancer. Just as I always say, your health is very vital to me, to your family, and to the nation Ghana at large. So stay safe and stay healthy. So we meet in the next video.